Hello, everyone. My name is Itumeling. I'm presenting on behalf of my team, the Health Squad. The problem we have identified is that a lot of people in rural areas have limited access to healthcare facilities. What this means is there are people that have to travel on average over 5 kilometers to get to clinics. And sometimes you find that people have to take taxis to get to hospitals, and even waiting for those taxis takes about 2 hours. And after that long wait for a taxi, they still have to get to the hospital and wait in queues the whole day before they can get assisted by the doctor or by the nurses. Another problem we have identified is a shortage of those doctors and those nurses in hospitals and also at some of these clinics. This is why people would go to clinics and come home without being assisted because you find there's only a few nurses that are available. The solution we are proposing is a mobile health clinic tracker app. And what it does is it allows patients to track mobile clinic schedule and routes. This means that the user can be able to see where the mobile clinics are and they can be able to see when they are coming in their area. They can also be able to book an appointment and they also get alerts for when the mobile clinics will be coming in their area. Another thing that we're going to try and tackle is to include basic healthcare tips and symptom checklists. This means you can check your symptoms on your own on the app and get some tips on how to stay healthy and to take care of yourself. Our product is a mobile app, and this mobile app connects rural users with mobile clinics. Another feature we want to put into the app is being able to consult virtually with doctors on a video call or with a phone call. Our target market are people who do not have access to location based clinic. By not having access, we mean people that are really far and they can't walk and they are old or they are very sick. These are the people that we are trying to connect to mobile clinics, or in another case, we are trying to get mobile clinics too. This is why one of our target markets is the mobile clinics themselves. We are trying to get mobile clinics to go to these places that don't have access to the healthcare facilities that they need. The people themselves are our second target market because they need healthcare facilities and they depend on those facilities. So we are trying to bring the two targets together and we are trying to cater for both of them. For mobile clinics, in this sense, um, they're going to have, we are going to enable them to have a booking option. They're going to get data. They're going to be able to trace um, the cases per area. They're going to be able to know that, okay, in this area, these are the people we are dealing with. These are the severe people that are sick, and which areas we need to go to maybe more regularly, or maybe they can be able to put a timeline to say, we need to visit that place because these kind of people need attention fast and they can be able to schedule their visits better. The size of our market for this scenario, we looked at the Capricorn district in the Limpopo province, and the population for that district was about 580,000 people. Of that 580 people, the people we are building the solution for is 75,410. These are the people that don't have access to clinics or that really struggle, and their solution would actually come, the solution we are building would actually come in handy for them. Our competition so far, there were a number of competitors, but the one that stands out is the telehealth by MediClinic because it also offers virtual consultation. There's actually a number of apps that offer virtual consultation, and we still want to add that feature into our app because it can help a lot of people that are not able to move at all and they can really use um, an advice from a doctor. Our indirect competitors is an app called BY's Clinic Finder. This is indirect in a sense that it helps you find the nearest clinic in your location. An example would be if you go to a new location and you get sick, you want to go to the clinic, you log on onto that app, and then you can find the clinic near you. And that's how they're different from us. We are connecting people to mobile clinics, but they are connecting people to location bound clinics. The approach we are taking is focusing on tracking mobile clinics for our patients. This is because when we were trying to do research for this project, there were not even a lot of mobile clinics in Limpopo. The paper that we found stated only 22 mobile clinics available in Limpopo. And if we can be able to bring clinics to these locations, then people can be able to know their availability and track when they are moving and where they are moving to. We offer basic healthcare tips and symptom checklists. This can help people to just keep track of their health in general. We also want to partner with the government and mobile clinics and offer efficient, tailored solution for our markets. The cost of developing this app would be about 750,000 rands, 350 of that going into development. And this is because development includes hosting the app, it includes the front end, the back end, the infrastructure, maintenance of the app. We also are interested in looking at ensuring data security and integrity in line with the POPIA as well. So we are going to put 350 into development. With marketing, we look at doing your outreach programs. We're looking at doing social media marketing. And also, we would like to go to these places and introduce our app while we do our testing, tell people about how the app works, and make them aware that there actually are mobile clinics that can come to their location. If they engage on the app, then the mobile clinics can actually be able to find where there is a need. For maintenance, we're going to use about 300,000, and this is just for operational support and for user support and for ongoing payments like your hosting platforms and your data storage and things like that. Our revenue model is to charge the government a fee based on the number of clinics that use our services. The billing will be in the form of a monthly fee to the local government for the number of mobile clinics that we are able to service for that local government, which means we'll be charging the mobile clinics per usage. This doesn't only ensure that the app remains free, because we would like to have our users access the app freely and also be able to scale and grow as we grow the app as well. But it also helps us sustain the revenue stream for our developers. This is my team, and unfortunately, I didn't manage to get all of their pictures in time, but I worked with a team of 5 people in total. There's 6 of us, and we all played a very good part in bringing this idea together. Right now, we're going to look at the prototype of the app that we are presenting. Here is the link. If you can't access it, please reach me on my number or send me an email. I can grant you access, and then you can be able to go through the app and test it yourself. Our app offers your basic login features where you can sign up, enter your details, and then it takes you to the login page. And then after you have logged in, you go to our landing page where you can have options to book an appointment, have a video consultation, track mobile clinic, request an ambulance, check your symptoms, or get some health tips. Not all our features work, but the basic features that we are implementing or we would like to implement first, they already have a structure in place, and this is what it looks like. What would happen is you are going to book an appointment for the clinic. You are requesting a booking, in other words. You select a facility, what kind of facility you need. And then, after you have selected the service and the facility and the date and the time, you can confirm or request your booking, and then it will show you the available doctors in that week in that area at that time that you requested. And then you can see which doctor would be more suitable for your needs at that time, and then you can click at that doctor, and then you can get their availability, or they will get a notification that somebody requested an appointment for them, and then they will confirm it for you, and then you can have your booking ready. The video consultation feature allows you to talk to specialists. These are doctors around the area that can be able to help you even when you're not able to physically go to their practices. You have specialists, and these specialists can be able to take your call, and they can be able to you can be able to choose if you want it to be a video call or if you want it to be a normal phone call. The track clinic feature works in a sense that you come to this page and then you search. When you search, it's going to give you a map, and this map is going to show you the location of the clinic at that time, or around your area. If it's close, it's going to show you where it is and how far it is from you, and if you can be able to go there. And if you can't, you can just make your booking. You can also be able to check where it's going to go to next. The request ambulance feature is not yet built, but this will also help people that have emergencies. They can actually request an ambulance, and they can get prioritized, and they can just get taken to the hospitals urgently. The symptom check is also not implemented, and the healthcare tip feature is also not implemented at the moment. This is the prototype of our app. Thank you so much for listening, and thank you so much for your time.